Today we are going to be talking about film placement using XCP instruments with a long cone paralleling technique. We have set up this tray in the way you would have it set up for a full mouth series of X-rays. If you notice, the films are placed so that it matches the configuration of the mount that is on the X-ray view box. On the tray, we have also placed any other supplies necessary for a full mouth series, such as the XCP rods and rings, cotton rolls, elastic bands, and a disposable cup in which we will place the exposed films. A full mouth series of X-rays consists of 18 films or images. When taking a full mouth series from start to finish, you would begin by taking 6 anterior periapicals, followed by 8 posterior periapicals, and finish up with 4 bite wing images. This does not, however, follow the exact order that you will be learning them, but when you actually take a complete full mouth series, you will want to follow this sequence. It would also be helpful for you to have watched the XCP setup video so you know how to correctly set up the XCP instruments before moving on to intraoral film placement. We would like to introduce you to Dexter. Dexter stands for Dental X-Ray Teaching and Training Replica. Let's show you how he opens and closes. You will be using him quite a bit in the next few months. If you pull the 2 levers together and pull forward, he will open. Let go of the rear lever and he will lock into the open position so you can place your X-rays. Squeeze the 2 levers together again and pull backward to close Dexter. Let go of the rear lever and he will lock into the closed position. It is now time to look at your patient positioning. The patient is positioned with the head supported against the headrest, with the occlusal plane parallel to the floor and the mid-sagittal plane perpendicular to the floor. This position will stabilize the patient's head and prevent movement during exposure. Now we are going to place the lead apron on our patient. Because our patient is Dexter and we never want to create creases in the lead apron, we are going to lay it flat on the patient chair. If we were working on a live patient, we would bring it up and adjust the thyroid collar around the patient's neck, securing it with Velcro in the back. For our purposes with Dexter, we will lay it flat on the chair so we get into the habit of using the lead apron each and every time we take X-rays. This limits the radiation exposure to just the mouth and the teeth. Our X-ray machine must now be calibrated to the images we are interested in capturing. Since we will be learning about bite wing placement today using film as the image receptor, our control panel will need to be set at the film setting. There are 3 options for various image receptors on our unit. By depressing the mode button and holding for 3 seconds, we can change it to digital. And again, by holding the mode button for 3 seconds, we can change it to phosphor plates. Since we will be using film today, we will only want the time setting to be shown. Dexter is considered an adult for our lesson today, and our panel will be calibrated to the adult icon. We will then choose the bite wing setting and make sure the bite wing icon light is illuminated. For this video, we will review the process of taking 4 bite wing X-rays. When taking a complete full mouth series of X-rays, we would normally take these images last, after completing anterior and posterior periapicals. Since bite wing images include only the crowns of the teeth, they have a less invasive film placement and are more comfortable for the patient. In the event of a difficult full mouth series, we can reassure the patient that the last 4 X-rays are the easiest and the uncomfortable X-rays have already been taken. For our demonstration today, we will show the right bite wings taken in a horizontal orientation and the left bite wings taken in a vertical orientation. We will be doing the right premolar bite wing first, using film as the image receptor. The film is placed in the bite block with the dot down. White is right when looking through the ring. Identify which of the two canines, maxillary or mandibular, are positioned further anteriorly. You will use this tooth to line up your film. Make sure that the more anterior canine is covered completely by the film. This will ensure that the distal of the canine will be captured on the premolar bite wing image. Place the bite block, touching the teeth on the lower arch. And gently close Dexter. The central ray should be directed through the contact area between the first and second premolar. It is now time to line up the PID tube with the XCPs to accurately direct the central ray. There are 3 steps to this process. The first step is vertical angulation. We need to look from a side view and make sure the line on the PID tube head is parallel with the XCP rod. They will look somewhat like railroad tracks. The second step is horizontal angulation. Looking directly down the tube head or in line with the XCP rod, make sure that they are parallel or equidistant from each other. This is what they would look like if they were not in a parallel fashion. This is what they will look like in a parallel fashion, again, like railroad tracks. The third step is to bring the rim of the PID tube to meet the XCP ring. We say bring to the ring. The tube rim does not have to touch the ring, but be in close proximity. We must do this without moving our vertical and horizontal angulation. It may be easiest to only touch the end of the extension arm to do so. After these 3 steps, take one final look at your angulations, vertical, horizontal, and bring to the ring. If all is parallel, go out and press the button to make the exposure using the warning signal. Clear! Come right back in to remove the bite block from the patient's mouth. We will remove the film packet from the bite block and place the exposed film packet in the disposable cup on our tray. This will prevent our exposed film from getting mixed up with the films we still need to use, as well as help us keep track of where we are in the sequence of capturing our full mouth series, in case we are interrupted for some reason. Then, we can pick up our next film for the right molar bite wing and return to the patient for placement. We do not have to recalibrate on the control panel for the right molar bite wing image, as all bite wings are taken on the same setting. The calibrations do not change in between exposures unless the operator depresses buttons on the control panel. Place the film in the XCP with the dot down for the side you are working on, and white is right when looking through the ring. You may notice slight film curvature when the film is in the holder. This is normal, but try not to force or bend the film while handling. Film bending will cause a crack in the emulsion, which will create a dark line within the developed image. Look to see which of the second premolars is most mesially located, and line the film edge up with the middle of that second premolar. This will allow the distal of the second premolar to be captured within the image. Place the bite block, touching the teeth on the lower arch, and gently close Dexter. The central ray should be directed through the embrasure area between the first and second molar. Again, we will line up our vertical angulation. Looking from the side, make sure the line on the PID tube is parallel with the XCP rod. If parallel, they will look like railroad tracks. Then, line up the horizontal angulation, making sure that the tube head and the rod are equidistant from each other the entire length. Again, they will look like railroad tracks. Last, bring the rim of the tube to meet the ring. without moving your vertical or horizontal angulation. Take a final look at your lineup, exit the operatory, and make the exposure using the warning signal. Clear! Come right back in as soon as possible to remove the bite block from the patient's mouth. Place the exposed film in the disposable cup on the tray and pick up the film for the left premolar bite wing. We will be demonstrating vertical bite wing placement for the left side using film as the image receptor. Positioning the film in a vertical fashion in the posterior region allows for the examination of interproximal areas and periodontal bone levels. There is no need to recalibrate the control panel as it is still set for bite wings. The film is placed in the bite block with the dot down, and white is right when looking through the ring. Place the bite block touching the teeth on the lower arch and have Dexter close gently. The central ray should be directed through the contact area between the first and second premolar. Line up the vertical angulation. Find parallelism with the line on the PID tube and the XCP rod. Look for the railroad tracks. Then, line up your horizontal angulation. Make adjustments so that the tube head and the rod are equidistant from each other. Lastly, bring to the ring without moving your vertical or horizontal angulation. Take a final look and make the exposure using the warning signal. Clear! Remove the bite block from the patient's mouth. Place the exposed film in the disposable cup on the tray and pick up the film for the left molar bite wing. The control panel is still calibrated for bite wings, so there is no need for recalibration. The film is placed in the bite block with the dot down. White is right when looking through the ring. Identify which of the two second premolars are positioned more anteriorly. Use this premolar to line up your film and be sure that the edge of the film packet is placed in the middle of the second premolar. Place the bite block touching the teeth on the lower arch and gently close Dexter. The central ray should be directed through the embrasure area between the first and second molar. Line up the vertical angulation. Position the line on the PID tube to be parallel with the XCP rod. Look for railroad tracks. Then line up the horizontal angulation. The tube head and the rod should be equidistant from each other. Then you can bring to the ring without moving your other angulations. Exit and make the exposure using the warning signal. Clear! Remove the bite block as quickly as possible and place the exposed film in the disposable cup on the patient tray.